Simone, if you'd like to do a self-introduction and then talk a little bit, an overview about your program.
Sounds good. Can everyone hear me okay? Yeah. Okay. Simone Hogan, I'm the Chief Operating Officer for the Healthcare Division at the Department of Veterans Affairs. I oversee the operations of our 8 state veterans homes. I'm here in place of our Deputy Commissioner, Eric Maitland, who is down in Mankato today doing a day-long work group and retreat with that nursing department at that university, really trying to always educate and inform future kind of professionals into this business on the benefits of working with veterans and potentially joining the state veterans homes as a career. I have been in my role for a little over 8 years. Came from the federal VA, so I think I figured out the difference, and I'm happy to always educate and inform others of who does what. The healthcare division in the veterans homes have a lot of interaction and work with the federal VA and healthcare service delivery as well as oversight. Professionally, I am a social worker by training. Have always really enjoyed working in the veteran community. I am not a veteran myself, but the proud daughter of a veteran who passed away several years ago from his exposure and service from Vietnam. So happy to share and hopefully provide some information about our 8 state veterans homes and the other healthcare programs we run.
Okay, and then next, Ben Johnson. If you do a self-introduction and just a brief overview.
Thanks, Trent. Good afternoon, everyone. Ben Johnson, Deputy Commissioner for Programs and Services with MDVA. I've been in this role for coming up on 2 years now, but I've been at the agency for 11. I am an active duty Navy veteran, proud member of the Chapter 6 DAV in Duluth. And I have been really, really proud to represent and work with Trent as a member of the Commander's Task Force. The agency gets to partner with these great veteran service organizations. So I've had the opportunity to work with DAV, both personally and professionally, with Trent since I started doing legislative work. My area of the agency started with programs and services. Then I moved to central office, which is our support staff. Did legislative activities for 1.5 years, then started running the Legislative and Government Affairs office, and then recently came back to programs and services. So I'm happy to dig more into who we are and what we do. But I would say if you're not familiar with the Commander's Task Force, that's leadership from the veteran service organizations in Minnesota. They are a critical component of our partnership. We're really excited to see this and have the opportunity to speak with you today.
All right, thank you. We'll jump in. We'll start on the home side. Could you give us, we talked about 8 homes in Minnesota, an overview of where those 8 homes are, what levels of care, that kind of thing? Just going to give us an overview of what's going on with veterans homes in Minnesota.
Sure. Sounds good. It's been a busy couple of years, so I will talk about our new facilities, but let's start with Minneapolis, which is our flagship home, the original facility that was built after the Civil War. Minneapolis campus has 3 levels of care. We have 300 skilled beds, which is your traditional nursing home, nursing facility. We have the domiciliary program, which is really geared towards veterans that are more independent with their daily care needs, but maybe are coming to us with mental health, chemical dependency concerns, homeless. And so that certainly meets a unique niche or clinical area. And then Minneapolis is also very unique. We have one of 2 adult day healthcare programs on our campus that are on state vets home campuses across the country. So the second adult day is out in New York on Long Island. So a real unique program. It's geared towards veterans that may have some cognitive impairments, dementia, living at home, maybe with family or spouse, but they need that respite or that break and that programming for additional support. Moving north, Silver Bay is up on the North Shore. Silver Bay is a 54-bed facility. located about an hour north of Duluth. That facility has been in operation for over 30 years. We have our Fergus Falls home near the North Dakota border. We just made an adjustment in our census in Fergus Falls. The goal has been to increase our private rooms and private bath options for veterans, and that facility is now licensed at 85 beds.
Okay.
We have our Laverne home, which is down by the South Dakota border. And that facility is licensed now for 64 beds. And then we have our Hastings campus, which is a domiciliary program as well. And about 145 veterans can reside at that campus. Our 3 new facilities, this was a really significant effort for the organization over the last several years. In 2018, we received the state funds in order to build 3 new state veterans homes. And then in 2021, we received the federal matching dollars. So those 3 new homes opened in 2024, and they are located in Bemidji, Montevideo, and Preston. Bemidji and Montevideo are 72-bed facilities, and then Preston is a 54-bed facility. So I believe, I wish I knew this for sure. I think that there are only a handful of states in the country that have 8 state veterans homes. California, of course, has a number. I think Florida also, but Minnesota is very unique for this commitment, I think, in state veterans homes with the 8 facilities. We're over 900 total beds and approximately 1,600 staff at this time. So a great footprint and hopefully a good option for wherever a veteran might be residing or desire to reside in the state.
Yeah. Oh, I'm gonna stay with you for this one because it leads into it. For those that are out here, maybe personally, maybe for a family member, what does it look like as the time comes to start considering going to a veteran's home? Who can go? What does it look like if you're, a lower level disability versus 100%? Can you tell us a little bit? I got a lot of questions about that. What's it look like at disability levels? And what's it look like when it's time to consider for yourself or for a family member, whether a vet's home is it's time to apply or when to apply to?
Sure. So all of the veterans homes, they do have a waiting list at this time. Veterans really, we encourage veterans or their families to plan ahead, especially based on if you have a particular location that you really are wanting to move into. We have an application that a veteran would need to complete if they are interested in getting on our active or inactive waiting list. There is a Minnesota rule that guides our admissions and waiting list process. It's Minnesota Administrative Rule 9050. First come, first serve. So a veteran is getting on the waiting list. And then as their name comes up, we then start reviewing their need for skilled nursing or a nursing home setting, whether we can meet that. So our website, I think, is the best place to go if you're interested in learning about a veteran's home or applying to get on the waiting list. I did bring some copies of our admissions application. Our veterans homes serve both veterans and dependent spouses. And so if you have a spouse that is interested in moving into one of our homes, they would be eligible to come into one of our facilities. We are limited in the number of beds that we can have for spouses. The federal government guides that. In our practice right now, we reserve about 10% of our beds to spouses of eligible veterans. Eligibility. When you do an application for admission, we're looking for you to send in your DD-214. We have a strong partnership now with Programs and Services, and they do a DD-214 review. to ensure that this is a veteran that meets the eligibility requirements under our Minnesota state statute. And so our programs and services teams, they're really the expert in those DD 214 reviews. Some of those I know can be a bit complex. And so we're really trying to ensure that that veteran meets the eligibility under that Minnesota state statute.
Hair.
To also move into one of our facilities, you have to think it's a nursing home, right? That's the highest level of care that someone might need as they are getting older or their health conditions are changing. And so there needs to be a need to come into the nursing facility as well. We're looking for clinical areas like how much support would somebody need from nursing staff with their management of their medical issues or administration of medications. How much support would somebody need in their kind of tasks of daily living, right? Bathing, showering, dressing, eating. And we want and are only able to serve veterans that have that need to be in a nursing facility. So timing of doing the application and the admission can be a little bit tricky.
It's a hard balancing act, right?
It can be very tricky because you might be waiting on the waiting list for about a year to admit, depending on the home. And so trying to plan ahead and talking to the facility about what your needs are and what that might look like, they'll really help guide that process and what the time might look like for you and or your family.
Yeah, I'll come back to you because I've got a lot of questions based off of that. But Ben is looking lonely over here. Sorry. If you could give us the high level overview of some of the programs that you oversee, services, and then we'll dig in a one or two from there.
Thanks, Trent. Actually, I could listen to Simone talk about the loans process all day long. She's very, very thoughtful and does a good job explaining it in words that even I can understand. So programs and services, we employ about 100 and it depends between 140 and 160 employees in our 4 directorates. We have some seasonal workers at the cemeteries who are only on during the summer season for the field labor work, but the vast majority of our teams are spread throughout the state. We've got currently 3 divisions, and I'm working on 3 departments within the division, breaking off a 4th one. We've got our programs, basically it's our field operations and claims team. We've got our education and veterans preference team. We've got our benefits and services team, and we're working on breaking off the memorial affairs team. So much like Simone's side of the house, we have been busy in the last 10 years as well. We have a veterans cemetery at Little Falls that was transferred to the state of Minnesota from a private entity about 30 years ago. And then in the last decade, we've expanded our footprint and have constructed new state cemeteries in Preston about 11 years ago, Duluth, just outside of Hermantown, 7 years ago, and then about 3 years ago, we opened Redwood Falls just out in Redwood County. So we have 4 kind of blanket the state in that regard and have been expanding our operations. And it's gotten busy enough now that I will be splitting off directorates. I'll go from 3 to 4 directorates in the next couple of weeks here. Pretty exciting. I've had interviews and an opportunity to find a new director to manage our memorial affairs team. For the claims and field operations team, this group of people partners pretty well with county veteran service officers throughout the state. I hope you all know who your CVSOs are. They are a great point of access for any veteran benefits. We call them boots on the ground, and we don't mean it to be detrimental or dismissive at all. They are the primary point of contact for our team doing claims, benefits, and development of appeals or the applications for pensions and the like. So that's our claims and field operations team. We also within that group have our CVSO training team, our women's veterans coordinator, and our tribal veteran service officers. Those folks work again with county veteran service officers and veterans throughout the state. And our last component is an opportunity that we've really tapped into the last year and a half or so to work at the hospitals, but also to work with our veterans' homes. We have a medical operations team who have been working with Simone and her folks to make sure that all of the veterans in our veterans' homes throughout the state have access to the benefits that they've earned. So when they come into the homes, the healthcare side is looking specifically at need, looking at services that can be offered, but we weren't always sure that every one of them had applied for, been approved for the disability or pension benefits that they've earned. And so the medical operations team has been working exhaustively to review discharge paperwork and ensure that anyone who's in our homes on the healthcare side has access to those benefits. They also have staff working at the VA hospitals. We've got them in St. Cloud and in Minneapolis to help, again, with people who come into the VA looking for assistance. They can come and talk to us and say, hey, my claims, I'm only at 10% for hearing loss or tinnitus, but I think I've got some more things that have come up as a result of additional eligibility at the federal level. Some of the work that you and your team in DC have been doing to add pretty significant opportunities for veterans who have been exposed to toxic environments. That has expanded our ability to serve veterans in the state of Minnesota. Education team, we've got claims representatives blanketing the state. Not all campuses in the state have a claims rep on site, but all the campuses in Minnesota State, and we've got a bunch of private universities as well, where we can offer services to veterans who have returned to Minnesota and are interested in going back to school. Those who are later in careers decided they want to get some additional training or certifications. They maybe want to get into, they want to be welders or they want to be electricians. We've got teams throughout the state who can help them with that process. And really, I think the most important part of that is having relationships with the colleges to make sure that we have spaces for veterans to go. It's not always an easy transition. I was a terrible student before I was in the Navy. I was even worse after. I didn't know how to study. And the schools that I went to didn't have a dedicated space or assistance for me. And so I really struggled to reacclimate to how to study and how to learn. And I think our teams at the colleges and universities are an exceptional resource for veterans who are trying to figure out, how do I do this? How can I be successful? How do I access my GI Bill? How do I access the Minnesota GI Bill? And that's the education team in a nutshell, I think. And then another area that we've been really busy the last few years, it is our programs and benefits side of the house. That is our State Soldiers Assistance Program. So that is funding for veterans with maybe financial needs. They have lost a furnace and don't have enough money or income to replace a furnace in December or January in Minnesota without a furnace. It's an emergency situation. So we have veterans relief grants available. We work with CBSOs. Maybe you can't afford to get to the dentist, or you haven't had an eye exam in years and you're not service connected for those items. We can work with you through SSAP. And so that's the State Soldiers Assistance Program. You may have heard about some of these recent emergencies where people, we had an emergency grant available for Bemidji when that windstorm came through and knocked down 1 million trees. We were able to help veterans clean up their homes and clean up their properties and get access to benefits. We had a grant available to them for those who had damage in the affected areas in Bemidji this past summer.
Okay.
And then I'm forgetting. The other big area is veterans homelessness, and so we've got within the programs team veterans benefits to try and ensure that no veteran in the state of Minnesota is unhoused. So it's a big job, big lift, lots of partnerships there. But our homelessness team is working really hard and has been very successful. One county is left to get a declaration of functional zero, which again doesn't mean that there is not a homeless veteran. It means that there's a system in place that if someone is at risk of homelessness or finds themselves homeless, that we have a system in place to help them secure stable, affordable housing to get them back on track. So the homelessness team, we're one county away from getting a statewide declaration. We're really excited about that process. So.
You also have the second best veterans legislative team in the state.
It's true.
That's incredible.
It's a close thing.
You went through a lot. There's a lot there. What's that?
An alibi. So, alibi. There is a lot there. We do a lot. Homes do a lot. The agency does a lot. And yet still people think, you're with the VA. My father-in-law, when he found out that I was working for MDVA, shook his head and disappointed. How can you work for those guys? Didn't you hear about the waiting time in Phoenix? And I said, that's not the VA that I work for. That's big VA. I work for the state VA. I know the veterans I'm serving. They're in my community. Oh, okay. And he hates the government in general, but working for MDVA in the state of Minnesota was quite all right for his liberty. Okay. But I did cover a lot. I had brought brochures that are out front, specific areas. So if you're interested in the cemeteries or the benefits, education side, we've got more information here, and then our link, that phone number is staffed 7 days a week. So if you have questions about benefits in the state of Minnesota, we have an opportunity to get that information to you directly. I'm also the easiest guy in the world to find in the state of Minnesota. Ben.Johnson@state.mn.us. I don't know how I got Ben.Johnson. There's about 50 of us, but I think, yeah. So thank you for the alibi. I followed it as.
No, it's great. And I'm gonna follow up with you here. So I think it's important to highlight that these are Minnesota controlled programs. Many are state funded or federally reimbursed. But when we talk about these, we're talking about some that are unique to Minnesota, some that are run uniquely by Minnesota, or run in different ways. And so you'll reference something like the State Soldiers Assistance Program. And if you talk to somebody from Wisconsin, then what do you mean they helped you replace your furnace? I got to fly a kite if my furnace burns out, or in other states. So I think it's important to realize that we have this unique set of very Minnesota specific benefits that need to be funded through Minnesota legislator, that need to be, staffed by Minnesota people and Minnesota employees, and that don't fall into the bureaucracy nightmare that is the federal VA office. And so I'd like you to, if you could, what is the most popular, we can be of opinion too, but the most popular Minnesota specific program, benefit, thing like that. And then what is the one that should be more popular and is underutilized by Minnesota veterans? Great questions. So in my mind, I'll do two things in terms of the programs and services side of the house. The State Soldiers Assistance Program, as Trent pointed out, is unique to Minnesota. And last year was its 100th anniversary. So it's been around to help veterans since the First World War. The goal really there is to make sure that if there's an emergent need, that we can find a way to help get someone either a solution or at least a partnership with a solution. So I would say that SSAP is the one that is very unique. There's a standing appropriation. We have to go to the legislature every 2 years to get it refunded to make sure that we can do the program, but then we manage it to the best of our ability. And it has a perceived bipartisan support. So I would say SSAP is one where it's a huge success, followed closely by our claims office and the field operations staff to make sure that everyone in the state of Minnesota has access to highly trained, highly educated claims representation, whether it be with a veteran service organization like our partners at DAV or the Legion of VFW, county veteran service officers. Those partnerships, I think, are critical. And I would say in terms of underutilized resources, Which one should be more popular?
That's tough. I think that with the decline in veterans population in the state of Minnesota, things have changed a lot. So when I started with the agency 11 years ago, we were more than 400,000 veterans in the state. And now we're down to like 275, 280. And so I think that it would be hard to pinpoint one that's more important than, or should be more well-known, because the demographics have changed so significantly. We're really scrambling to get this homelessness thing buttoned up. And I guess I'd be remiss if I didn't point to the healthcare team and their efforts for suicide prevention. I think there's a pretty significant opportunity. The legislature recognizes it as well. Trent and I have had a lot of conversations about how do we better do this work. And the legislature kind of heard that loud and clear and said, there's more opportunities to do suicide prevention activities. What do you guys think? And we said, well, that's kind of a healthcare initiative. That's a population health kind of thing. And someone said, yeah, I guess we'll take it. Sorry. And I shouldn't put it on you. I should put it on the deputy. But I think that's an area that there's an opportunity to continue to do more focus, and the legislature recognized it. I think the veteran service organizations recognize it, and there's really a big opportunity to get out and do more in that sphere. So, your favorite topic?
Yeah. That is, worked alongside Ben with legislation, and that is the perfect legislative answer. The program that should be doing more is under somebody else's purview. So, thank you, Deputy Commissioner.
Could be.
Yeah. Not should. Could. That could increase.
Words matter.
Yes. I'm sorry. It could be doing more.
And it's.
Yeah. I highly recommend that it do more when it gets more resources. Back to the veterans homes. You covered a little bit on why how that balancing act between the wait list and when it's time to enter a home, how difficult that can be. I've heard at times Minneapolis Home has had, gone over a year. You hear kind of anecdotally that it creeps up maybe 2 years. Why is the state veterans home still the way to go? Why is it worth kind of navigating those things, supplying the documents, finding out eligibility? Why is it still worth going through that process?
I think there's a couple of reasons for that. I do believe, and I think everyone in this room should feel very proud of the care that's delivered in our homes. The environment, I think, is very remarkable, whether it's one of our legacy homes or one of our new facilities. When you compare us to a community nursing home or what the community is experiencing in their environments, I think we're really fortunate. And I think there's great support for us to continue to invest in the environment and make sure it's a desirable place for a veteran to live. I think the response that we have from a quality oversight standpoint, whether it's the federal VA, the Minnesota Department of Health, or CMS, they're in our facilities all of the time, evaluating how we deliver care and if we're meeting the regulatory requirements. Overall, those reports and those visits result in very positive remarks. Do we at times have concerns? Absolutely. And I don't think that we're unique compared to any other healthcare organization or senior facility. But I think overall, the quality that's delivered is really exceptional. I had polled recently, so CMS does an evaluation on a star rating for all nursing homes in the country. If you're a CMS certified facility, they rate you 1 to 5 stars, depending on your performance during regulatory surveys, the information we submit to review quality data, and all of our facilities are either a 4 or 5 star facility. From a staffing standpoint, all of our facilities staff at a 5-star level, meaning that I'm staffing more nurses and certified nursing assistants in my homes compared to other facilities across the country. So our staffing ratios and the amount of time that a veteran or resident would have with the staff is far higher than the community facility, down the street. The other, I think, real benefit from a quality standpoint is just really the environment of camaraderie, right? I think veterans really enjoy being in a setting where there's other veterans. The activities and the things going on day to day are very veteran-centric, and that would feel different than a community facility. And so hopefully then their quality of life is much improved because you're really participating and interacting with others that have media-like or similar experience. The other real benefit in Minnesota is, I think, from a financial standpoint, and we see a number of veterans come to our waiting list for that reason. The first question I always get is, how do I apply? And then, do I have to pay for my care if I come to a state veterans home? And my answer is, it depends. If you are a highly service-connected veteran, 70% service-connected or greater, you would not pay anything towards your care. The federal VA is covering the full per diem and then the state appropriations in order to meet those care needs. If you're less than 70% service-connected, you may have to pay some towards your care, and it really depends on what your income and assets are. But what's different from if you were to come to us versus a community nursing home is you can transfer your assets to your spouse the day before you admit.
1 day look back, I believe is what they call it.
Correct.
1 day look back.
And you can transfer your assets to your children 1 year prior to admission. And so the ability in order to make sure that your family has those resources is very different than a community nursing home under the Department of Human Services rules of medical assistance, or how maybe another senior might move into a community facility. So your monthly charge for your care is reviewed based on what income you have coming in, considering that maybe you transferred your assets to your spouse. And then we also then factor in what is that spousal allowance, if your spouse was still residing in the community, to be able to continue to reside in their home and have all of those day-to-day, month-to-month bills covered. And so I think there are some real financial kind of advantages in order to move into a state vet's home, which, certainly helps and makes that more appealing. But my goal is always that we're driving your desire to come to us because of the quality of care that we provide, the services that we provide, which I think are also very unique and hopefully meeting an exceptional standard.
I think the quality, definitely, if you can wrap that up with the ability to save some of the assets that you've built up over a lifetime and to give less of those, to spend those down for care, it's a nice bonus. But the quality, having the opportunity to work with other states and look at the national policies, I wish I had better statistics, but Minnesota's veterans homes and those star ratings sets it apart. It really does set it apart. There's not a home that you point at in Minnesota and go, yeah, they're good, but you don't want to get stuck over here, or yeah, except this one. And that consistency from your team and from all the homes across Minnesota is just such a high standard. How is that maintained? How do you continue to evolve that model?
Well, it's maintained probably because I have very high expectations to maybe some regrets sometimes of our new staff. The last 5 years have been incredibly challenging for senior healthcare organizations. The COVID-19 pandemic really shook us all. And it was a real difficult time for several years for us to work through that experience and that emergency and then recover. And we really had some significant challenges that I think we're starting to rebound from as it relates to staff. We saw a mammoth exodus of staff leave senior healthcare and healthcare in general. That experience was very, very challenging, stressful, and people decided to choose a different career path. And that had great impacts for many of us. We had to reduce our census. We had to not care for as many veterans because I didn't have as many staff in order to do that. I feel really fortunate that we're in a much better place this year, and I think we're starting to really recover from that. Some of our legacy homes are sitting at a 97 to 100% occupancy right now. That means that I have maybe 1 or 2 beds available in a month. That's a positive. That means that I have the staff in order to care for as many veterans as possible in that facility. We're really committed to education and ensuring that our staff receive the education that's required, but also the education that we desire to deliver high quality care to those that are in our responsibility or in our facilities. And so that means that we have to continue to understand the clinical needs that are coming into our homes, the veterans that we're serving, and ensure that our staff are really capable of meeting that. And I think we're really up for that challenge. And hopefully we'll continue on that course.
Yeah, excellent. Thank you, Ben. I got something jotted down here. It just says Minnesota GI Bill. Show of hands out there. Who knows what the Minnesota GI Bill is? For those of you watching this, nobody raised their hand. No, there's several hands up. But who out there is eligible for the Minnesota GI Bill? So 1, 2 in the crowd. Ben, can you tell us a little bit about the Minnesota GI Bill?
Happy to, thanks. And I appreciate everyone who did not raise their hand in the crowd because I didn't know about it either when I started school back got out of the Navy. Minnesota GI Bill is the last dollar in the program available to veterans attending higher education. We've also expanded it for OJT and apprenticeship opportunities and also licensing and certification. So it is a fund available to Minnesota veterans up to $15,000. Again, worked with our partners in Commanders Task Force, Veteran Service Organizations to expand the amount that was eligible for use over the lifetime of a student. So it went from 10 to 15,000, and you can utilize it to pay for tuition. Utilize it to pay for books. If you want to do OJT and apprenticeship, you could utilize it to have an employer or a trainer receive the stipend on the front end and back end of an OJT opportunity, and also some reimbursement for yourself while you're getting the apprenticeship or OJT done. The other one that we think about a lot is the apprenticeship, the licensure and certification portions at the end of it. If you finish your career and you're working on becoming a nurse, it's not free to get that license. And so there's an opportunity and we can help ourselves in that way, that if we're helping to train LPNs or RNs and they need to get a license, they can use the Minnesota GI Bill money to help pay for the cost of getting that testing done and the preparation for that testing done to get the certification of licensure. Minnesota GI Bill is accepted, I believe, in all institutes of higher learning in the state of Minnesota in some form or fashion. And it is an excellent opportunity to help defray costs. Things have only gotten more expensive. So even if you have a great, you've got a Montgomery GI Bill or a post 9/11, the benefits that the state of Minnesota offers, including the Minnesota GI Bill, make it a lot more affordable to finish your degree, up to and including underwater basket weaving. Even that.
Cool. Who's eligible?
Minnesota veterans attending schools in the state of Minnesota. It's residents. I hope everyone in the room knows what it takes to become a veteran in the state of Minnesota. It's a little bit distinct from the feds, more inclusive, exclusive. I don't know how you would describe it. But so the standard really is 181 days of active service, or you've completed federal service, and if you're activated in the Guard or Reserve, even if you didn't do a full 6 months, you can become a veteran so long as you've got an honorable discharge and completed your term, the orders, whatever they are. So yeah, Minnesota veterans in the state of Minnesota have access to the GI Bill, and it's an outstanding resource. I would just say that similar to what I said earlier, your CVSO or your claims reps, the campus representatives in and around the state of Minnesota can give you very specific information about how to apply for it, how to secure the benefit, and make sure that the schools understand what it takes to get these students paid, get the tuition paid, and so forth.
Thank you. Who out there is eligible for the Minnesota GI Bill? Oh, every one of you. You're a Minnesota resident and a veteran by statute. You're eligible for it. So the next time you call up an electrician and they say how much it's going to cost, let them know you're going to go use the Minnesota GI Bill and do it yourself. 2 years of electrical training, and there you go. But there's continuing ed opportunities, things like that. If the GI Bill has expired, if you run out of eligibility, the Minnesota GI Bill is there. Late career certifications, new interests, training programs that you just kind of want to take. They become opportunities with the Minnesota GI Bill, right?
Yes.
Yep.
And a component that I often neglect because we see so few of the applications, but currently serving members or dependents of deceased or severely disabled veterans are also eligible. It's less common now, but since September 11th, so we call those the recently separated veterans. So most of the last 20 years, anyone who has even a DAV uniform after September 11th, we see the currently serving members or deceased or the surviving dependents of deceased or severely disabled veterans also have access to that as well. So thank you.
Thank you. Another topic for you here. I heard we have ended veterans homelessness in Minnesota. We can pack it in, put it all away, and close the book on that one, huh? We are done. You've ended it?
You heard wrong. Sure did. We're close. We're very close. And the effort to end veterans homelessness in the state of Minnesota really has taken an immense amount of money, time, and resources to get to the point where we're at. We've got all but one continuum of care, which is again a group of counties or regions in the state that have been combined from, I guess the initial was the U.S. Interagency Council on Homelessness identified these areas for us or helped us identify them. All but one continuum of care have achieved what we call functional zero, again, which is not that there are no homeless veterans in those areas, not that there's never going to be another homeless veteran in those areas, but that if there is a homeless veteran, that there's a system in place to make sure that that period of homelessness is brief and non-recurring, to make sure that we've got access to programs to get people affordable housing, despite whatever barriers they may have. We heard Simone talk a little bit about the DAWNS program on our healthcare side. There are veterans in the DAWNS program who have come through the Homeless Veterans Registry process to get access to that stable housing. Some people have barriers to housing. Either they have a poor employment record or mental health or chemical dependency issues. We have the opportunity to get them support and resources to get them into a place that is stable and then get them on the way to something that is more permanent. So not done yet, but we're getting there. We've been pushing hard. USICH was basically defunded to the point of being disbanded at the federal level. And that's the group that makes the declarations. But we've been working with the federal VA to try and determine a new path forward to say, how can we declare functional zero in the state of Minnesota? We've got this one county left. By our metrics, we think we're there. We've got about 197 veterans on our homeless veterans registry as of today. Again, these are veterans that we're working with to secure resolution, to find them permanent or supportive housing. We think that we've got the numbers in place and we can do a statewide declaration. We're just waiting on Secretary Collins to come back and tell us how we do that. How do we get that declaration? So,
Thank you. I kind of knew some of that. I hate the terminology around end veterans homelessness. Functional zero is it's a concept that takes a while to explain because people will leave here and they will see somebody holding a sign on the side of the road, homeless veteran, anything helps. And it makes the idea that we've declared an end or a functional zero feel like it's something that's maybe not genuine, right? And then my concern with that has always been we don't want to lose the resources. It looked like in this last session, like we might lose some resources. You want to talk a little bit about that balancing act of trying to recognize all of the hard work and everything that goes into getting you to where you're at, but with the continued fight that has to go on. Thank you for that. This was an interesting session, I guess, and I won't do the analogy justice, but one of our program staff has pointed out to me, you could think about homelessness like you think about an emergency room. You don't always need to go to the emergency room. Sometimes you just go to the doctor or a clinic. But when you're in the emergency room, you need that help now. And when you get out of the emergency room, it doesn't mean you're never going to need it again. And so if you think about homelessness in that construct where it is, you might need help now. It might be an emergency room. You might just need some support. You might need to be working with our education team to get some training, to get a better job, to be able to afford your lifestyle, your living situation. It doesn't mean you're never going to fall into a place where you can't afford it anymore or start struggling with employment or chemical dependency is a significant issue. Programs and services, our team collaborates with Lutheran Social Services to help veterans, not just let's stabilize your financial situation, let's help you deal with your trauma. Let's help you deal with your chemical dependency issue, a situation dealing with alcohol. And the legislature kind of sees it in the same way that a lot of you do. I saw a guy down the corner with a veteran sign saying, I would take anything, paid the help. And it is jarring for them because they think we've spent millions of dollars on this homeless veterans registry and the programs to help acquire housing opportunities that in the public. How do we get there from here? And we still have people in the corners. I'll say not everyone wants help. Not every veteran, even identified veterans proven through a 214 and a good discharge, wants the help that we have to offer, because oftentimes in settings like ours, there are rules associated with it. You need to be getting help from the VA. You need to be asking for help. You need to be trying to get sober. You need to be accountable. And that's a difficult thing to ask a lot of people. Not everyone wants to adhere to those rules. And so some of those that you see are people that we found and we've given cards to and said, hey, come in, we can feed you. Let's get you a disability claim.
Not everyone wants to approach it that way. But I think to your question, Trent, the legislature is like, we've seen enough, we've spent enough, we've done enough. You've got these great systems in place. We've got community partners like the Minnesota Assistance Council for Veterans, MACV, who have received more than enough money. This should be done. Let's pivot to something more significant or something that is more pressing, like I mentioned earlier, suicide prevention. But the way to maintain our system is not to just cut it off. Help us get to the finish line. We're not spiking the football and then running away from it. The game's over. We need to continue to have resources in the community because there will be challenges that people face, men and women, veterans, and their families. So we need to have a system that is able to respond, because we'll backslide into it again, and it'll be the same issue that we're dealing with everywhere. And so trying to pivot and make a case for homelessness funding, while also acknowledging that suicide is a major issue amongst veterans, and not trying to diminish one in favor of the other, saying both are important, and we think we can be working on both. It was an interesting session, though. There was just a lot of, we've already done it. Why are we spending more here? We said we can do both, but let us at least, if we can get a glide path to reducing some of the funding going to the homelessness programs so that we can sustain and maintain these partnerships, especially, that's the best way for us to go. And the legislators, they came through for us really in a bipartisan manner. It's one of the great things about working with Trent and the CTF and the legislature is the vast majority of the time, if you have a uniform on, they don't care if it's a D or an R behind your name. They really don't. They just want to help you, and they want you to help the community that you're serving. So that's maybe a little sugary, but it's true. At the legislature, for the most part, they care more about who you're serving in this community.
Thank you. Yeah, it was an interesting development, and I like the emergency room analogy, because having been around for over a decade, I feel like we've just, if you're going to continue that, we just basically had a mass casualty event, right? We had COVID, the lifting of the eviction moratorium, where we've seen the numbers spike again. And to continue your analogy, it would be like saying, "Hey, we made it through that. Let's shut down the emergency room." Pretending like there's never going to be another time. So it's one of the things we do as an organization, is to continue to advocate like that. All right. In this room, we're going to go one more homes, and then I'd like to talk a little bit about suicide prevention. We have a lot of leaders from areas with veterans' homes in the area. In what ways, other than financial support through voluntary services, can these chapters and key leaders in their community support your mission?
Great question. And in my handout, I have a little acknowledgement of that, because I think our veterans homes are really fortunate, and probably what makes them so unique from your other traditional health setting is the support we receive from community members, and specifically our veteran service organizations. I know that we have several individuals here representing our public affairs and volunteer coordinator role, but whether it's monetary or in-kind donations that are coming into the facilities in order to enhance the recreation opportunities, the activities that are offered to our residents, that's exceptional. We are so fortunate. We would not be able to do what we do without that support. But I think it goes broader than that. And I think when we see community members coming into the facility in a volunteer capacity, whether you're coming in to call bingo on Sunday, you're coming in to do a one-on-one visit with a resident, or you're hosting some other meal event or activity that the whole facility is able to participate in, that is what really enhances the quality of life for our residents. It helps our facilities with some accountability. We really appreciate and like that community engagement, because we get additional perspective and feedback on how we can do better and improve on the way in which we deliver our care. And so there's so many examples of how this organization has supported our homes, and I really encourage you to reach out and find a way in order to just continue that visibility our veterans and staff. It's just really part of our operations and our day to day, and we would not be as successful without it.
Excellent. Suicide prevention.
Mhm.
So, Ben, I've kind of hinted at it. Every once in a while, I get frustrated with suicide prevention, especially organizations that are just focused on awareness. We're aware. We're aware, right? I mean, is there anyone in this room not aware that we have an epidemic of veteran suicide in this country? Anyone who's aware that we have it? Can I see some hand there? Every hand. Okay. We are now aware of it. I'm hoping that as the state develops, I know you're in the early days, early stages. I'm hoping that something that's not built around awareness is what can be developed. Is there the work headed in that direction? Are we looking at something that's actually solutions based? I hope it's not awareness. I don't think it is, but if it is, then maybe there's a chance to pivot. But everybody is now aware. We no longer need that step. How can we move forward? How is your program looking?
I appreciate the question. In particular, as I mentioned in my introduction, I am a clinical social worker by training and background, and have had professional experiences with veterans where thoughts, an attempt, or an actual suicide has occurred. And as a clinician, that weighs extremely heavy on someone. You constantly are thinking about what you could have done better or differently in order to have a different outcome. And there are several individuals that probably come to my mind more often than maybe I wish as a clinician of what I would have done differently in supporting that individual. And that, I think, is a question that I raise to our director on a regular basis. So I'll take a step back a little bit. Rachel Johnson is our new director of community health. The Department of Veterans Affairs has taken on the challenge of a suicide prevention program. In addition, we are also working to roll out a community health program where we have stronger presence and more just visibility of our agency in community health systems, with the goal that we're able to reach veterans if they enter into an emergency room or a health system in a greater Minnesota in a different way, provide education and resources to them to ensure that they're connected with the veteran community moving forward. And so Rachel Johnson has been in her role for approximately a year. As the director of this program, she has a big challenge ahead of her. And I think that she has a real strong professional background and focus on that community health perspective, and really helping ensure that all systems are, as best as we can, aligned to ensure that wherever a veteran may seek out support or resources, we're helping educate and connect them with those that maybe serve as we're subject matter experts in this space. And I think that in this first year, she's made some really good headway at connecting with some of our major health systems, educating them about this issue. And then how do we ensure that they have systems in place so if a veteran enters the emergency room or seeks out care from a community provider, that we're connecting them to those VA or veteran-specific resources. And we're doing that warm handoff so that they're working with somebody that really has the expertise in how to support them in whatever issue is presented. Outreach is a significant component to their work. And I think that there is a space that we want to continue to do that. And so ensuring that we're educating that we have resources out there as you opened up, right? Still, there is a lot of confusion within our veteran community about what the resources are. What does MDVA do versus the federal VA? And so Rachel's team spends a lot of time providing education, not just on the resources available, but also on how just a community person or somebody that's not clinically trained can identify the risks. If somebody was coming to you based on a kind of a suicide assessment, what are the mental health or behavioral health circumstances that I should be looking out for? And then how can I, as a community member, assist them in finding them the resources that might be available? So I think connecting all the dots, I think, is really the focus and a big challenge. And I hope that she can continue to do that successfully.
I know that was a hard question because
Yeah.
it's hard to answer with suicide without saying awareness, but you did very good. I'm pretty sure I'm authorized to do this. I'm declaring an end to the awareness stage. And then moving to the actual training and assumption stage. We had a solid decade of awareness. But I know some of the things is bringing the training to the community. Like that's separate from awareness campaigns. That is, could the server at the local VFW be trained in safe training, right? Could they be trained? Could different people throughout the community be trained in ways to start to find the veteran prior to the crisis or as the crisis comes? So it's not that there won't also be awareness. It's that we're aware. Now let's start to work on the problem. And I feel like we get stuck spinning our wheels in awareness campaigns and in 988 Press One. That's a great resource. Now, how do we train the people we're not accessing through the last decade of awareness? So I know the work is happening in your program, and I am aware of that. So,
Yeah, I think we all need to be able to, and the training can help, but we all need to become comfortable being able to ask sometimes very difficult questions and being able to really support a veteran that may be having those thoughts with accessing the support or resources. And I think that training is really what we are advocating for and really trying to push. It can be very difficult if somebody is sitting next to you and they express that. Okay, what do I do with that? And how do we really develop that comfort? So it's okay to ask some of those difficult questions and really help that veteran that find the resource so that they feel supported and to check in with them. And honestly, our veteran community is best equipped to be able to do that. The way in which you are able to establish camaraderie with other veterans and support them in whatever their journey is, you have there's just great opportunity for us to equip you with those questions. How do you ask those questions? How do you respond then to those answers? And then how do you help somebody then advocate or get to the professional that then may be able to assist them in those next steps? You are best equipped to really be able to do that because veterans lean on other veterans for that support. And so I think one of their big efforts in this last several months is I think they're going to literally every American Legion in the state and delivering boxes of resources, but having conversations with those coast individuals and bartenders about how you have that conversation and how you look for signs so that in your community you're helping on somebody at risk.
excellent. I'll let you off the awareness. How about that? We've got jotted down here, SOAR program. Could you touch on the SOAR program, and then I have a follow-up question for you? Sure.
Just to make sure that I get it right. 988, then press 1. You recommend it, absolutely, right? All right. You're right. Okay. I think, and I'll push back a little bit because I'm not afraid of trends. I think the awareness is not just community awareness of an issue. It is also awareness in the sense of, does a veteran know what to do if they're thinking or feeling that way, or if they come across someone who they are concerned about? The data doesn't bear out that if you ask someone, are you considering suicide? And using the word, the data doesn't bear out that you're going to push someone into suicide. In fact, quite the opposite. So it's an awkward question. It's really hard. The training, even just play acting, asking a coworker during the SAFE training was kind of blew my mind. I can't even ask you with a straight face because it's really uncomfortable. But asking someone, are you considering hurting yourself? Are you considering suicide? It's really important to be able to say that, and making sure that they are aware of the resources that are out there. It's not just community awareness; it's that the veteran understands. And even the training that we had was call 988 with someone, tell the person who answers, hey, this is a test. I just want this veteran to understand how this works. I want to understand how this works. So long as you tell them what's up, then they get some familiarity, and it's not an uncomfortable thing. So I'll push back a little bit, but I understand the awareness. We're all aware. The SOAR program is a part of our homelessness and activities. It is an opportunity to help veterans who are struggling financially but have some eligibility to Social Security. We work with them to develop SSI and SSDI applications, help bridge the gap between, in some cases it is, they are not yet ready for retirement, but they have some benefits available. It is an opportunity to help them while it's a long process and it's really involved, but it is helping them get access to benefits that they've earned outside of the claims for a disability process. So the team is small but mighty. They do a lot of really, really good work. We've been able to, we had a couple of people depart in the last 2 years, and we've been able to onboard some new SOAR reps to help with that process. And really, it is a one-on-one conversation with the veteran and their family to help them go through the process of applying for Social Security benefits.
And the eligibility for that help, like, is there specific eligibility you might? So the question I got was that a claims service officer had referred someone to SOAR, and they were told, we help homeless veterans or those at threat of being homeless. And so the problem was the service officer didn't understand, can I get this person help? Like, yeah, they're at risk of homelessness because they don't, so is there an eligibility like that, or is that a miscommunication? What's going on?
I would say that's probably a miscommunication, but it's another one of those it depends answers. And I think don't ever hesitate to reach out to our SOAR team or our homelessness team to ask and give them the rundown of what the person is experiencing. I can't guarantee that every person who reaches out is going to get access to the program, but don't hesitate to ask. Don't hesitate to put them in contact with the homelessness team and the SOAR team. They're under the same umbrella. They have different criteria, and I don't have all the eligibility, but it also really depends on the lived experience of those veterans or their families. So don't ever hesitate to ask. And if there are struggles and it's like, I don't understand why this didn't work or how this didn't result in a positive acceptance of that representation, work your way up the chain of command and say, I'd like a little more clarity here. We're always trying to be as transparent as possible because the misnomer of the question is challenging. And SOAR Social Security applications are really challenging. I don't think I could process one myself without help from one of our team. So thank you.
All right. We're gonna push us to our final question here. And the scenario is, I want to look at the future. It's 10 years from now. It's 2035. Commissioner of Veterans Affairs, Trent Dilks, has just been fired after 12 days. 12 of the greatest days ever. No, but it's 10 years. It's really 10 years to the future. What does Veterans Affairs in Minnesota look like under your programs? How are you gearing up? I know aging veteran population. I believe it will become a crisis because nobody's gearing up for it at the federal level. The resources aren't being funneled. But what does it look like as that wave of Vietnam veterans comes in and as it recedes? And what is the future, MDVA, on your side?
Yeah, I believe the projection right now is this is quite scary. I think by 2030 to 2035, for senior healthcare, we're going to reach our peak of individuals seeking care. And then for us, I think a bit even more concerning is a reduction in healthcare workforce. Those exiting healthcare because they too are aging. And so really ensuring that we're prepared for that peak is critical. I need to ensure that I have staff in place and that we have pipelines and opportunities so that we can continue to serve the maximum number of veterans in our homes. So we do that by partnering with various educational institutions so that we have nurses, social workers, the whole interdisciplinary team getting exposure during their clinical student experiences into long-term care. So they develop a passion and interest in serving and working for us in the future. There probably isn't just a lot of us anymore that are really excited about senior healthcare. I started working in a nursing home when I was 22 and trying to share that experience and what that profession has really brought me. And it's been a very rewarding career. How do I share that within that future generation so they make that same choice? Because we really need that, and that's really what we're striving to do. So partnerships with all of our colleges and universities, and also I think as young as our high school age students, getting them that exposure. Preparing for the clinical needs that veterans will come to us with, that is also looking very different, and we need to ensure that our staff are well educated and ready to respond to those clinical needs, especially as our Vietnam era veterans age out and we have a younger generation coming in. Every era comes to us with different kind of hallmark diagnosis or issues or concerns that we need to be very prepared for and well educated on. And so we're always trying to anticipate that and really ensure that our staff are well educated. Part of the reason why we made some of our environmental changes in our homes and creating more private rooms is many of the veterans that are coming to live with us now, we have more stuff. We have more equipment. We have more personal things than maybe our World War II generation, right? And so ensuring that we have environments to manage the specialty wheelchair and specialty equipment. And do I have technology that's ready to support this generation of veterans that we haven't really had to think about maybe in our older generations. And so that clinical preparedness, but also ensuring our environments are ready is also a real focus for our division.
Yeah, I was just pulling it up here. 53% currently of Minnesota's veteran population is 65 or older.
Correct?
You have 55 in, and 55 or older, you get us up to the street. Hold on, I went to public school. 19. So that's 41 plus 31, 72.
Sure.
Yeah, it is.
Yeah.
72%, 55. I mean, I know I start to sound a little alarmist, but I am really worried about this next decade. The aging population, and go to Washington and try to talk to them about the amount of veterans they're going to be responsible for the care of, and those who will become 80 plus, and those types of things, and get the blank look. And it's as an organization, as veterans, as those who are supporting veterans, I don't think it's alarmist. I think We really are in for a rough decade if we can start to move now like you are. So thank you for doing that. Yeah.
Correct. And I think that's where our partnership with the federal VA comes into play also, right? I have limited capacity in the number of veterans I can serve. I have available 950 beds, and that's not a huge percentage when you compare it to the total veteran population in the state. And so working very hand in hand with our VA healthcare system in order to ensure that they also are providing services and making that available to veterans is just as important. The federal VA has many programs that are geared in order to help veterans remain in their home and their community as they age. They're providing home care services. They contract with community nursing homes. The VA has their community living centers, which is a community nursing home type setting. They contract with adult day healthcare programs. They offer respite, and really reminding them that they also need to continue those programs is critical. But I also have a vested interest in ensuring that those programs stay open. And we do that by ensuring we have a workforce in order to work in them. And so while I would love to make sure that all of my 1,600 vacancies are filled, I also want to motivate, right, the whole potential applicant pool to consider this as a rewarding career, whether you work for us or you work for the nursing home down the street, or you work for the federal VA. There's a lot of benefits in working and devoting your career to healthcare. And I think it's even more rewarding if you have a niche in senior healthcare and veterans. But how do we really motivate so that all of the system can stay run? And you're right, federally, we need that advocacy.
Yeah, and every once in a while, I like to make myself panic about this again. So I just dug into these demographics again because it's important. And over half of those are in rural Minnesota, in greater Minnesota. And so I love looking at, greater Minnesota demographics. It's interesting because as they lose young people, they become very, very top heavy and elderly people. And so if you look at my old hometown with 1,200 people, it had a nursing home. It's running out of people to work there. But there's a wait list to get in because that top heavy elderly population is ready to just when there's no staff, that's when they're overwhelmed with requests. So the makings are all there for a very tough decade. Thank you for keeping focused on it. We'll keep working on advocacy, try to keep talking to people about it. They'll probably won't react until the dam is broken. And then there'll be a lot of finger pointing and it'll cost 10 times as much as it would have on the front. And that's where we're at. And same scenario, 10 years, what are programs and services looking like?
Well, we're trying to recover from the scandal of Commissioner Bilk's last 12 days. I think the glide path for programs and services is to continue to make sure that our partnerships in the communities are strong, that we're working to support. So it's interesting because the education side of our team primarily focuses on veterans, to some extent spouses and dependents. But there aren't that many people coming out of the military having had a career in medicine. There's a few, there's a number, but trying to show them the value of continuing to serve by pointing to healthcare as an opportunity. I think Deputy Maton is in Mankato today, and he's talking to the nursing program down there. We have an education regional coordinator down there who we made aware that, hey, if there's an opportunity to show up and make sure that these nursing students get a sense of what the veterans resource center looks like, where it is at. Even if you're not a veteran, it's something to consider. So, but in programs and services, really it is this functional zero. I mean, we're to the point now where we can be the fourth state in the nation to declare functional zero. And the first major state in terms of the veterans population that we serve and the communities that we serve. So it's a huge win. It doesn't have to be political. It can be, the president can declare it, the governor can declare it. It doesn't matter to us who does. so long as they don't cut the resources and we have an opportunity to keep this thing moving. The other, I think, big component for us is making sure that as Congress looks at ways to make decisions about serving veterans through the regional offices, the claims processing, some changes you guys have probably been aware of, this idea of a national work queue where we are no longer advocating just for Minnesota veterans. CVSOs are not just advocating for the team that they are submitting claims for. We kind of are the victim of our own success in St. Paul because it's such a good claims office. We are now having a lot of our claims have been the last 10 years, having our claims farmed out to other regional offices for the development and evaluation of those claims. But I think in the next 10 years, we continue to see really strong partnerships with VSOs and CVSOs. We had DAV and VFW claims reps doing service officers doing training for the MA CVSO assistants in Duluth this week. So being able to continue to maintain those partnerships. I was going to go back to something that Simone said earlier about how do you support the homes in your communities. I guarantee you have members who are residents of those homes. So don't forget that there are folks in those homes who are DAV members, life members who have served this country. It's the same, I think, for the way that we serve veterans, even if it's a diminished number of veterans or they're aging out. That it is really important that we continue to have the partnerships and that we don't drop the ball just because we're down to, I guess, 10 years, we're probably down to maybe 200,000, 180,000, 150,000. The veteran population will decline, but the need won't. And I think something that someone said about the generational differences in the care that is needed, that's for my team too. That's how do we respond to folks who were downwind of a burn pit, people deployed to some of those sandboxes, and what did they experience, and what do we learn about that, the maladies that are affecting them in the next 10 years, because we just don't know yet, 10 years, 20 years down the road. So, and I would have been advocating for your ouster much earlier than 12 days.
Yeah. Thank you. I would like to thank you both so much for this conversation. Thank you.